Then the internal genital organs that consist of pair of ovaries, pair of fallopian tube, single uterus, vagina, external genitalia and the mammary glands. The main internal organs includes all these things along with mammary glands. See properly this figure. So it includes uterus. This is whole uterus. These are the fallopian tubes. This is the ovary. This is the vagina, and mammary gland is also included in the female genital tract. Now first we discuss about the ovaries. This is the ovary. So what is ovary? So it is located deep in the pelvic cavity on each side of the uterus and connected to the broad ligament by the mesovarium. It is dull grey in color. There is a difference of stages in ovaries before puberty and after puberty. In a pre-pubertal state, there is a connective tissue capsule called tunica albuginea, and below there is ovary. There are three layers like that. This is ovary. So outer covering is called tunica albuginea, that is only present in pre-pubertal stage. Then below this there is a cortex, and inside there is a medulla. So three layers. Outer is tunica albuginea, then below there is a cortex, and inner is medulla. Normal size of the ovaries are 3.5 centimeter by 2 centimeter by 1.5 centimeter. So in general, if you want to remember as a quick, simply remember 3 to 1. So it's easy to remember 3 to 1 ovary size. So ideal size of ovary is 3.5 by 2.5 by 1.5 centimeter. What is the function of the ovary? It is required for the maturation and the maintenance of the secondary sex characters. Whole the female sex characters or structures, development of the mammary gland, development of the pubic hair on the genitals, all and starting of the menstruation, all are managed by our ovaries. It is the storage house for female gametes and developed ova. Egg maturation is under the control of hypothalamus pituitary ovarian axis. You have heard about the HPO axis, hypothalamus pituitary ovarian axis. So if HPO axis is very well maintained, then and then menstruation can happen, and then patient can get pregnancy. So maintenance of HPO axis is very important. Then formation of ova. During the embryonic development, the germ cells are differentiated into oogonia, that is undergo mitotic division, and the primary oocyte is surrounded by single layer of the squamous cells called primordial follicle. At puberty, what happens? Because up to puberty, pre-pubertal stage, there is no hormones of reproduction are secreted. But once the puberty is achieved, there is a activation of HPO axis. So there is a link starting from hypothalamus, pituitary and the ovary. So HPO axis development started. This HPO axis leads to, under the influence of FSH, there is a primordial follicles grow, enlarge and become primary, secondary and tertiary follicles. That is the matured follicle which is responsible to give rise to the pregnancy. In short, इतना जानना है कि अगर HPO axis maintained है, then it gives rise to the healthy egg and it gives rise to the healthy pregnancy. If there is a problem at this HPO exists, then we can't get the healthy ova and can't get the pregnancy. So, importance is at birth, the God has put 1 million of primordial follicles in the cortex by process. So, when it reaches to puberty, only 40,000 follicles will remain. Out of this 40,000, only 5 to 10 follicles at each menstrual cycle undergo maturation, and in whole reproductive life 400 follicles only attains maturity. So in short, in a female only 400 follicles God has given to the female. Average 400 follicles are about to mature. So every single egg is very important for the pregnancy conception. So that's why without proper diagnosis, never prescribe drug, because EU are prescribing drugs for formation of the egg and ova continuously. But if you don't know the proper cause, then that egg will be wasted. So very limited number of eggs are there. So has to be utilized in a very precise way. Then blood supply. Ovarian artery. Ovarian artery is a branch of abdominal aorta, means main aorta, and partly by uterine artery. Veins, there is a pampiniform plexus, drains into the inferior vena cava. Now the fallopian tubes. We discussed about the ovary. This is a ovary. Size is 3 by 2 by 1. Main importance is the formation of egg, and in female all characters are developed under the influence of this ovary, and for pregnancy HPO exists, that is the hypothalamus pituitary ovarian axis, to be maintained. Now we discuss about the fallopian tube. It is 12 centimeter long, conduct monthly discharged oocyte from the ovary to the uterine cavity, situated in the medial 3/4 of the upper free margin of the broad ligament. Fallopian tube is 12 centimeter long and conduct monthly discharge of oocyte. These are the main parts of the fallopian tube: infundibulum, ampulla, isthmus, and the interstitial and the cornu part. What is infundibulum? Infundibulum is outside. First, this is the infundibulum. Here, infundibulum, ampulla, isthmus, and cornu. So, infundibulum is distal and 1 centimeter long, opens into peritoneal cavity and contains fimbria. Fimbria is the organ that carry egg from the ovary to the uterus. So, in short, fallopian tube acts as a transport of the egg from the ovary to the uterus. Ampulla is widest 5 meter long, and fertilization especially takes place here. Isthmus is round cord-like structure 3 centimeter long. Interstitium is 1 centimeter long and opens into the uterine cavity. Functions of the fallopian tube is mainly egg transfer facilitated by ciliary bits. So main function of the fallopian tubes, this is a fallopian tube. So mainly here there is a ciliary movements are there. This like cilia are there. So with the help of this, the like a wave forms in the river. So the egg will be travelled by this cilia from the ovary to the uterus. If there is this problem or damage to this cilia, fallopian tube won't transfer the egg. Then the uterus. It is an inverted pear-shaped hollow muscular organ lies obliquely between urinary bladder in front and rectum and sigmoid colon behind. Size of uterus is 7.5 by 5 by 2. Simply you have to remember 6 by 5 by 4. I am remembering like this. Ovary 321, uterus 654. Exact size is 7.5 by 5 by 2 centimeter. Weight is 90 kg, 90 gram. Parts of the uterus are fundus body and the cervix. This is a uterus. This is a uterus. This is a cavity. So part is divided like cavity के above का जो portion है that is called fundus. बीच का जो portion है that is called body and जो opening है उसको बोलते हैं cervix. So the uterus is divided in a three main part: fundus, body and cervix. Cervix is 2.5 centimeter long. The slit-like cavity of the cervix is approximate 6 centimeter long. There is a cavity, like suppose this is a, so there is a cavity where fetus live. So this cavity is from external os up to the fundus, it is 6 centimeter long. This is very important. It is 6 centimeter long. There is a slit-like cavity which expands in pregnancy. Then uterus have main three layers. This is uterus. This is cavity as we discussed. इतना पता होना चाहिए. जो outer layer है, this is outer layer. That is called perimetrium. Middle layer is called myometrium and inner layer is called endometrium. So outer covering is perimetrium, middle is myometrium and inner is called endometrium. And this endometrium also have two layers, basal layer and the functional layer, inner. This is cavity. And this inner layer have also two layers, basal layer and functional layer. So during menses, every time this functional layer is shed and basal layers remains there. But if there is a repeated DNC or by repeated curating or by curating done by unexperienced hand, this basal layer get damaged. This basal layer get damaged. So there is a damage at basal layer, so patient may develop amenorrhea because blood supply will be stopped at this level. So patient will not get menstruation. So after repeated delivery or repeated DNC, many patients suffers amenorrhea due to trauma at basal layer. Clear? Okay. Blood supply. Uterine arteries with collateral supply from the ovarian arteries and the veins drains into internal iliac veins. Then the axis of the uterus is also very important. Understood this portion. This is axis of the uterus. So 90% of the uterus, if you had seen written, it is anteverted, anteflexed. What is mean that? Anteversion means angle of uterus to the angle of vagina is called anteversion. See, this is the anteversion, angle of cervix to vagina, which is 90 degree. So it is called anteversion. And angle formed by body and cervix at isthmus level. This is isthmus. Isthmus means starting of cervix is called isthmus. This is cavity. This is cavity. sorry, the isthmus and here cervix. So the angle is formed between body and cervix is called anteflexion, that is 125 degree. So 90% of the uterus are anteversion anteflexed form, means they are resting on the urinary bladder. But 10% of uterus could be retroverted retroflexed. What is that? Uterus is resting on bladder. Suppose this is uterus, this is vagina, this is bladder. Okay. If uterus is lying this, it is called anteverted uterus because it rests on the bladder anteriorly. So 90% of the uterus are anteverted. But what happens? This is uterus and this is rectum. So if the uterus falls towards rectum, it is called retroverted. Simple. So this is, I hope this is understood. What is anteverted? What is retroverted? There is a difficulty in getting pregnancy if there is a retroverted uterus because axis is totally changed. So the sperm has difficulty to traveling at in retroverted uterus. So always there is a problem for getting pregnancy in retroverted uterus. So it is clear, anteversion, anteflexion. Then the vagina. It is a musculomembranous tube 7 to 9 centimeter long, 7.5 centimeter long anteriorly and 9 centimeter posterior wall. It runs upwards and backwards up to the vaginal part of the cervix, where vagina forms fornices around cervix, anterior, posterior and to lateral. Suppose, what is fornices? This is, suppose this is uterus. This is vagina. So, the space formed anteriorly, it is anterior fornice, here is lateral fornice and behind is lateral fornices. So, this completes mainly your anatomy. Clear everyone? Have any doubt? Then we will go for the physiology. The main hormones in infertility. There is a hormonal evaluation. 1 second please.